Reoccurring miscarriages. What causes reoccurring miscarriages and how can they be treated? Good day everyone and welcome to my channel. I'm a seasoned and certified medical microbiologist Gwendolyn Hale, and I'm popularly known as the medical professional with the difference because I bring you knowledge like no other to the comfort of your living room at your doorstep like no other. If you're a returning subscriber, this is me telling you thank you. And if you just stumbled on this channel, stumbled on this video, and you love my content, please give it the thumbs up, share, and subscribe. Thank you. Let's roll in. Welcome back. Into this class, we're going to be looking at 10 causes of reoccurring or recurrent miscarriages in women. Miscarriages is no joke. In fact, many women go through mental health, serious mental health that really affects their ability to get pregnant again. So if you're having reoccurring miscarriages, please do watch this video and get some insight, some knowledge on what may be or could be causing reoccurring miscarriages and how you could treat it and how you could prevent it. Now, the first on our list is stress and intensive physical exercises. And this normally occurs between 0 to 3 months of pregnancy. Most women who go through a lot of stress and a lot of intensive physical activities, or maybe sports, for example, some activities like climbing on a bike, actually doing a lot of activities that stress the body, even having stress mentally, some issues that may be disturbing the lady mentally could actually cause her to have a miscarriage. The second point is drinking alcohol and smoking tobacco, marijuana. This could actually lead to miscarriages in a lot of women. The third point is infections, and we are talking about herpes simplex virus, we're talking about chlamydia, we are talking about German measles, and a lot of other sexually transmitted disease that affect the development of the fetus, and that also leads to miscarriage. The fourth point is the blood clotting disease. When a lady has a blood clotting disease, it actually prevents the flow of blood to the placenta. And in this case, we're talking about the red blood cells. Bear in mind that the red blood cells are responsible for carrying oxygen to different parts of the body. So in this case, when blood clots, it actually prevents oxygen from reaching the placenta. And when the placenta doesn't get enough oxygen or enough nutrients, what happens is the fetus or the zygote would actually die and they would come out of the body. And that is how a miscarriage occurs. The fifth point is an incompetent cervix. This happens in a lot of ladies around the world. In this case, the muscles of the cervix are weak. The cervix is actually the mouth of the uterus, the mouth of the womb. So when these muscles are weak, what happens is the baby is not able to stay in the womb. So miscarriages can occur, or recurring miscarriages occur. The next point is uterine fibroids. If you've watched my previous videos on fibroid, you will understand that fibroids can take up a lot of space in the uterus or in the womb. If there's not enough space for the zygote or the fetus to implant himself in the uterus, it would actually come out of the woman as a miscarriage. The next point is uterine structure abnormality. This is when the uterus is abnormal from birth in a woman. And in some cases, or in most cases, you find a lady with a folded uterus. And in this case, there's not enough space for the zygote or the fertilized egg to implant himself in the uterus. And when there's not enough space for the zygote to implant itself in the uterus, miscarriage occurs. The zygote or the fetus would come out of the woman. The next point is hormonal imbalance. If you've watched my videos, I've actually stated all the hormones that are responsible for fertility in a woman, and that is the follicle stimulating hormone, the luteinizing hormone, progesterone, estrogen, that are responsible, and a lot more that are responsible for a woman's fertility. But in this case, we are going to focus on progesterone, because progesterone is responsible for the pregnancy. It actually babysits and takes care of the pregnancy, the child in the mother's womb. So what happens when there are low levels of progesterone or high levels of progesterone? What happens? A miscarriage occurs. The next point is chromosomal abnormalities, and this could occur in male or female, or in the man or the woman. You know, the male is responsible for 23 chromosomes, and the woman is responsible for the 23 chromosomes that join together to give a zygote or a baby. So when there's an abnormality with the chromosomes and a zygote is formed, what happens is, when this fetus or zygote starts to grow in the woman's body will reject the pregnancy, will reject the fetus, because of this abnormal chromosome. The woman's body will begin to look at this fetus as a foreign body, and it will send it out because it has few or low genetic material. In fact, the woman's body will be looking at that baby as a cancer or a disease or an infection. And that is how miscarriage is going to occur. Now, at the last point, which is the 10th, which is very common in many women, is rhesus factor incompatibility. Now, when we go to the hospital and a blood test is done, we find out our blood group. We'll normally see on either the A, B, a negative or a positive. That's what we call rhesus factor. Now, I'm going to give an example. Let's say the man has a rhesus factor negative and the woman is rhesus factor positive. The child in the woman's womb will be rhesus factor negative. Now, what happens in this case is, if it's the woman's first pregnancy, her body may just ignore that pregnancy, and she may give birth properly. But if it's the second pregnancy, what happens is the woman's body will begin to look at that rhesus positive baby as a foreign body, as a pathogen, as a cancer, as a disease, as an infection, and begin to fight it. And that is how miscarriage would occur. We are going to talk about the treatment of recurring miscarriages. And the first thing you have to do is you have to go to the hospital and check your blood group and know your rhesus factor. And if your rhesus factors are different, an injection will be given to you guys. If the woman has an incompetent cervix, when she's pregnant or when she takes in, what happens is her cervix is going to be stitched to actually hold the pregnancy in place so that miscarriage doesn't occur. If the lady has a uterine fibroid, what happens to it is going to be detected by scans, and then it could be taken out through surgery, or some hormonal pills will be given to shrink it, and then it will be taken out through surgery. If the lady has hormonal imbalance, let's say her progesterone levels are too high or too low, a hormonal drug could be given to her to actually balance out her hormones, and she'll be able to give birth normally. If the miscarriage is caused by infections after doing several tests, drugs can be given to clear out chlamydia and clear out gonorrhea or all the other infections that are actually preventing the fetus from developing. If the miscarriage was caused by a chromosomal abnormality, a test called genetic cryptotyping can actually be carried out to determine or detect the amount of chromosomes in both male and female. How can we prevent recurring miscarriages or miscarriages? The first thing you have to do is, before you start having kids, make sure you know your rhesus factor and you know your partner's rhesus factor. This is going to help a lot, because it will help the doctor actually to be able to give you the injection when it is right, at the right time. The second thing is, stop smoking and drinking alcohol at the early stages of your pregnancy. Reduce stress and intensive exercises. That's the third point. The fourth point is, do a test to find out if you have any sexually transmitted disease. And most importantly, use barrier protective measures. Use a condom, male and female condoms, to protect yourself from any warts, any herpes simplex virus, any form of sexually transmitted disease that occurs by body contact, not only by fluids. Be conscious of your reproductive health from a tender age. When your daughter or when your son hits puberty, educate them on the importance of preserving their fertility. Most of the cases of recurring miscarriage, of infertility in men and infertility in women, have gone so bad or have entered tertiary stage because they were ignored at the primary stage or when the individual was younger. Most of these cases of causes of recurring miscarriages could be prevented if the individual, if the lady was conscious of the changes in her body while she was younger. So thank you for joining me in today's class, and I hope you have learned a lot about your body, of what could be going on in your body. And thank you for watching, thank you for sharing. I remain your seasoned and certified medical microbiologist, Gwendolyn Halle. Bye-bye.